I know it's like the end of a really long day, right? But thanks for coming for this part of the conference. I'm Dr. Christine Kannler, and I'm a dermatologist up in Boston. And the reason why I am here today is because of my brother. My brother Peter was a Chelsea firefighter, and at age 36, he got esophageal cancer, and he passed away at age 37. That year that he was sick, I had done a ton of research. I had read every study out there, and I learned a lot about firefighters and cancer. I had known about firefighters and the cardiac issues, but I had no idea about the cancer issues. At that point, so that was 2015, 2016, and then soon thereafter I started screening firefighters in Massachusetts, and this is Joni. Joni is alive, she's working, and she has a stage 3 melanoma that was treated. So hopefully we can have more stories like that. So my goal today, we all know this, firefighters have an increased risk of cancer and skin cancer. But my role today is to try to teach you guys what we have done in Massachusetts, where we are now, and how we got there, okay? So basically, I alluded to this, I had read a bunch of the studies. We really seemed to gain our momentum with the studies in 2014 with the NIOSH study because there was 30,000 people in it. And that's where we had enough power to show that firefighters got cancer sooner, and the types of cancers that they got had a higher rate of mortality or death. And the NIOSH study, though, did not have melanoma included in it. The first study that was done on firefighters and cancer was actually in the 80s in Boston, and that one did include melanoma. But the largest study looking at a big population was the Nordic study, and that study was significant for a couple things. Number one, it showed that melanoma could happen in firefighters as early as 40 years old, and it also showed that prostate cancer can happen in firefighters as early as, or as young as 40. Those were also shown in the most recent meta-analysis, so we have a lot of good data now. The issue is that we need to work on basically the US task force cancer screening recommendations, because until those change, it's still gonna be hard to get the screening tests that we want or that the firefighters deserve to screen them for cancer in an appropriate manner. And so when my brother first got sick, I started thinking about this a lot, and I actually called the person at Tufts that was on the committee at that point at the US task force. And until we have data, we really can't do anything. And until we have data, the insurance companies aren't gonna pay for it. And until we have data, it's hard to get a primary care doctor to write for a test when we need to educate them more about the risk of firefighter cancers. And also, it's hard for them to write a test that they don't know how to code for, or they wonder if it's really gonna be covered. And so you can see, as you already know, that there's a lot of difficult issues here. And then finally, doctors in general don't wanna do harm, and we don't wanna just order a test if it's not valid or isn't gonna give us good information. So with all of that in mind, this is the current Massachusetts protocol. And so what happens is that a fire department in a town or a city will call Abby Baker at the Department of Fire Services, who then initiates them for the taking action in the fire service class. That's free. You folks can get that too. The National Fire Cancer Support Network has it. It's awesome. They just updated it. So then the trainer from the Mass Department of Fire Services goes out to that fire station, teaches them, and then what will happen is Abby will register them for free skin cancer screening. And so then I'll show up to the fire station, and sometimes we have oral cancer screenings as well. That's changed a little bit with COVID. Right now it's purely educational because we don't want to spread COVID. But the person that does, the dental hygienist who does the oral cancer screenings is a volunteer firefighter, and she's a dental hygienist, so we've been able to utilize the resources that we have, and you can do the same through family members, other associates, whatnot. So those top two are pretty much free, which that's a good cost. And then finally, once the firefighter has done the first 2, they can qualify if eligible, and eligibility is determined. They have to be a Massachusetts state citizen because it's a grant from the Massachusetts government, legislature. And they have to be at least 40, be in the fire service for 10 years. So once that happens, they can get their low-dose lung CT. We actually, in the grant language, we had written in that if a person didn't live in Massachusetts, some Massachusetts firefighters live in New Hampshire, they could pay the cost of the CAT scan themselves. And so we've been also able to get around some of the eligibility issues. If people want to pay for it, they can pay for it. They don't have to have been on the force for 10 years. That test wouldn't have really helped my brother because he was 36. So if someone is really worried, they can pay $200. So what we were able to do is it went out to bid, and we bid it to the cost to be Medicare rates. And so we were lucky UMass applied and was accepted. And so basically the CAT scan is $250. It's basically a photo of the person's body from their thyroid to their esophagus and their top of their stomach, their lungs and their breathing tube, the lymph nodes in the middle of the body, so that would get a lymphoma, and the top of the stomach. And so what will happen is if something is found, then essentially the person's own insurance, which they have through their department, will kick in for the screening or the follow-up. So we were able to get the lung CT for these people to then follow them and track them and hopefully prevent a cancer like my brother's. The blood PSAs, that's a cheap test. It's not expensive, and so we were able to add that in so that way more people would be screened for that. When we determined these tests, we looked at what the insurance covered, and we tried to come up with a test that would give us the most information that wasn't going to be covered by the insurance. Oh, the other issue with the lung CTs is because it was a cancer grant, we couldn't include the calcium score, which is also done in the same CAT scan. So firefighters, if they wanted to, could pay an additional $100 and get their cardiac calcium score, so that way we could take care of the top 2 health risks of firefighters, cardiac and cancer. In order to get the lung CT scan, you have to have a primary care doctor. The results actually go to the primary care doctor. They don't go to the state fire service. And so there is that confidentiality that people are concerned about, and rightly so. So this is the map of Massachusetts as of today. For the skin cancer screenings that we have completed, we've been to 100 locations. There's been 2,400 firefighters screened through the state. In addition to this, I also have screened firefighters through PFFM annual meetings, and also at the Boston Fire Department. That's the largest fire department in the state. And so usually what happens is I'll go there 4 weekend days, and we just bring the trucks up, they get off, go to the bunk rooms, and then they go back and we rotate the next truck off duty for the screenings. And usually for those screenings, we can do 80 to 90 people in a day, and I have help from other dermatologists. So how did we get there? In 2015, the Department of Fire Services in Mass decided to start teaching the teachers at the Fire Academy to teach the taking action in the fire service course, so that way they could educate firefighters. And ironically, my brother was a trainer that they had taught, so that was going on. And in 2016, I went to the 2 fire departments that my brother had worked at, Chelsea and Westwood, and I basically said, look, I can do free cancer screening. We can do it here in the bunk rooms. And then I worked and spoke with the union, started the union. I would go to a few union meetings, educate folks about melanoma and skin cancer, and I approached Boston Fire Department as well. And so basically, given my brother was a teacher at the academy, I went there, and then everything just kind of fell into place. And finally, the other tier was the fact that the PFM was speaking to the legislature in Massachusetts. And basically in Massachusetts, the way how this works is that the insurance companies give money to the state for training of firefighters. And so the PFFM asked if some of that money could be earmarked for cancer screening. And so that's how we were able to get that grant money. So when I show up to do a skin cancer screening in the fire stations, these are the handouts that I recommend and we give out. So this is excellent. It's an app. Everyone can download it into their own phone. And every fire you go to, you can record. You can record the date. You can record the type of fire, the location of the fire, where you were in the building, if there are any bizarre chemicals involved. And this is important because God forbid, years from now you get sick. You don't have to go through all those logs and try to piece it all back together. A couple clicks every time you go to a fire will allow you to be in control of your data. This is the other handout that I really like. This is, the graphics are great. You can download this from the internet. It explains your job as a firefighter, as a tactical athlete. And it explains your job and the risks and the exposures to the physician and why you need these certain tests that we're asking them to order. So I would recommend that you print it out, give it to all the folks where you work, tell them to bring it when they go for their annual exams. And if their doctor isn't receptive, I would say find another doctor. What we've done in Massachusetts is when we give these out, we ask around, hey, do you have a doctor that follows these guidelines? And if they say yes, we ask for that doctor's name, we have a list, and then we try to feed it forward. I don't know any of those doctors personally, but we give out their names a lot. We already talked about the state legislature. I'm going to go to the next slide. We also give out this handout. It's the top 11 things that you can do to lower your own risk of occupational cancer. There's some great actions that you can take. And also they have a lot of other great handouts that we'll post in fire stations, like no gear beyond this point. The handout that we give for the skin cancer part is right here. And usually what I'll do at the beginning of the screening is I'll go through all the 3 types of skin cancers and educate people what we're going to be looking for and how people can do their own skin exams. And then once you've got that information, you can use the see something, say something. If you notice something on one of your colleagues' neck, face, hand, give them flack about it, or her, to get it checked out. So here's some photos of what this all looks like. So here, this is at the Fire Academy. So we also screen the recruits when they first come in. And so here we are doing the skin exam. This is an example of a spot check. So you can have one spot looked at, just your head looked at, above the waist looked at, or full body. We try to get people to do the full body, so that way we can check the backs of legs, the back of backs where you can't really see anything. Here is an example of the oral screening setup for the oral cancer. So you really don't need a lot of equipment. Here we are in Duxbury. So this is Abby Baker and I and some of the fellow firefighters. In the stations, I just use the bunk rooms, and I'll bring some bright lights. Here we are. Sometimes I'll use the special operations vehicle. It's a little loud, but it's got air conditioning, and it's got good lights. So we can do these at exhibits. We can be pretty mobile with this. So let's talk about skin cancer. So melanoma, 1 person in the US dies of melanoma every hour. The usual person who gets melanoma in this country is a 65-year-old Caucasian male. And so now we know firefighters, because of the Nordic study and these other meta-analyses, can get it 40. So that's a big difference. This is a melanoma in a firefighter. So basically, the Academy of Dermatology has come up with a little saying, ABCD. So that way you can know what to look for. So A is for asymmetry. So this lesion here is not a mirror image if you draw a vertical line or a horizontal line. The next one is border. These borders are bumpy, and some of them are a little fuzzy, like someone took a eraser to it and kind of smudged it a little bit. C is color. This thing has like 5 different colors in it. We want all your spots just to be one color. Or if there's one mole or freckle that's a different color than everybody else and it stands out, then you should get that looked at. Diameter is basically the bigger a spot is, the more chance of something going wrong. And then finally, we have evolving. So what I'll say to folks is, I've screened you for all of these, and everything looks great. There's one spot that I'm just not sure about. Let's take a picture of it with your cell phone. Let's set an alarm for 3 months, have someone in your family, if it's on your back, or you, if it's on the front. Take a look and just compare. If it looks exactly the same, great. Set your phone for another 3-4 months, and then do it again. And if it changes, then you know what you need to do. You need to give your doctor a call. The best thing, too, is that you have a photo of what it looked like before, so there really shouldn't be a question about what needs to happen, because it's clearly changed. It needs to come off. So melanoma is the worst type of skin cancer. Then we have 2 other skin cancers. This one is the basal cell, and I like to think about it as the basal cell being the best one. It grows slowly, it doesn't spread, it will grow locally, but it's very rare for it to spread to other parts on your body. And so they kind of look like pimples, like this one over here. It's a little pearly, it's a little shiny, it's a bump. This one actually happens to have some pigment, that brown, which is rare but can happen. So if you have a pimple that it's been there for more than a month or 2 months, it's not a pimple. Or if you keep getting a boo-boo in the same spot, it heals up a little bit, then it comes back, heals up a little bit, comes back, get it looked at. Another big story with basal cells is, I just keep cutting myself shaving. It's not that. It's the blade, the pressure of the blade on your skin, on the cancer, just makes it fall apart. Cold sores never last more than a month. If you think you have a cold sore and it's been there for more than 2 to 4 weeks, it's not a cold sore. That's huge. The next slide is squamous cell. So this is the middle of the road cancer. Most of these people do well, but there is the potential for it to spread to other parts of your body. So your skin should always feel smooth, nice and smooth. It shouldn't feel rough. It shouldn't feel gritty. If it feels rough or gritty, then you want to put Vaseline on it every day for like 2 weeks, and then it should be gone. If it's not gone, it could be something like this, a squamous cell, or it could be eczema, psoriasis, an infection. Who knows? It just needs to be looked at. Once again, here's that cold sore. That's not a cold sore. And then there on the top of the ear is that rough, scabby squamous cell. For some reason, and we don't know why, ears and lips are high risk for squamous cells in terms of they can spread quickly and easily to the inside of the body. So you really, really want to take it to heart that cold sores do not last more than 2 to 4 weeks. So here's some other squamous cell carcinomas that can look pretty gross. Here's a crater, a nodule with a crater in it, rough horn, and then another rough spot on the scalp. So basically for any type of skin boo-boo, it should be healed within 2 weeks and gone. If it's just flaky, feels rough, bleeding occasionally in the shower, those are all the things that you want to look for. So the other thing that I want to teach you guys about is when you're trying to get resources that you can't get through traditional means, clinical trials or clinical studies or local universities are a great way to get stuff done. So this, you can all go to this website. It's going to look like this. You're going to click recruiting and not yet recruiting studies, type in firefighters, and then you'll get a screen like this. And so what's on the top of this one is the Mass General lung CT study that's ongoing. And so any firefighter that goes to Mass General can get a lung CT, similar to the ones that are happening in the state of Mass. And so this is huge for people that live in New Hampshire, Maine, Vermont, Rhode Island, even Connecticut, or anyone that wants to take a drive. Come to Mass General, get your lung CT done. It's free. If you've gotten your lung CT done elsewhere, you can send your results to Mass General and they'll include it in the meta-analysis. With COVID, I'm hoping that there'll be more remote or login options for research. Here in Florida, Miami has all their great studies. So definitely check this website. And check it more than once, because things are always changing. So here, this is the final slide. These are all the resources. The top is my email, so if you have a question, shoot me a line. The next one down is the American Academy of Dermatology's telephone number. So they have this cancer screening program that's been going on for 30 years. There's no reason why it can't be applied to firefighters. We know you're at risk. And I would argue you're underserved. I mean, who can find a dermatology appointment these days? So what you're going to want to do is call that number. You can try to see if they can hook you up to a dermatologist. I'm actually speaking with them later this week and next month to try to help that along. If you've got a training program, a dermatology training residency program, that's a great resource. And then finally, your local dermatologist, call them, call the office manager, ask if there's any dermatologists that are part of that practice that want to help out and do some free cancer screenings. There's the email for the Mass General Hospital Lung CT study. There's the National Firefighter Cancer Support Network. They have great classes, a lot of great handouts. And then finally, the clinical trials. So that concludes my talk. Anybody with questions? No? All right, cool. I'm going to pass the torch to the next part, and they're going to go over more about how they're using their mobile van to get firefighters the healthcare they need.
All right, thank you guys. Good afternoon. My name is Johanna. I'm the nurse navigator with the Firefighter Cancer Initiative. I work with Aimee in the mobile clinic. My other role is to help coordinate care for firefighters that have been diagnosed with cancer. As a fun fact, I am a nurse, but I'm also a paramedic. I've been a paramedic longer than I've been a nurse. I left my fire department to come work with the initiative. So clearly, this project is very, very dear to my heart, very personal to me. And so today we're going to talk to you about the clinic, but I'll let Aimee introduce yourself.
Hi, my name is Aimee Green, and I'm the nurse practitioner with the Firefighter Cancer Initiative. I have a background in family medicine and also have an additional certification in nutritional and metabolic medicine, which just means that my toolbox is a little bit bigger than the average healthcare provider that you may have seen, which comes in handy with our firefighter population. So today we're going to be talking about our mobile clinic and how we're using this as a model for healthcare, namely cancer screenings and primary care in the fire service.
All right, so we'll go back in time for a little bit. So as Dr. Colbert said in her opening speech, we started back in 2015 because there was a group of firefighters that said, hey, all these guys are being diagnosed with cancer. It's a problem. Let's do something about it. So throughout that time, we did different projects. We created a very extensive survey where we asked firefighters, tell me everything that I need to know about this. What is your job? What are your decontamination procedures? When was the last time that you went to the doctor? How often do you go? All those things. And what we found through analyzing through some of that data is that most firefighters don't really go to the doctor to get just a general wellness clinic. As a matter of fact, I always joke about it and say you probably haven't been to your doctor since you left your pediatrician's office, and most of the times it's a yes. So then we identified a problem, and we said, all right, so how about we create a clinic where we can do cancer screenings, a clinic that it's only for firefighters, and let's see how that goes. So that's what we did in 2019. We opened up our cancer prevention and wellness clinic. We had locations, or have locations in Miami, Broward County, and here we have Coral Gables in downtown Miami to just try to expand, right, and provide the services. Back when we opened up in 2019, we had a very specialized approach, right? So we had an oncology certified nurse practitioner. That was great. But we were also getting feedback that we were very limited to what we can do, right? Because now we have to follow the standards so that the insurance covers the visit, and it was very complicated. And it was somewhat like a dissatisfier because not everybody was getting, screened. So if you were on your 30s, your visit was a little bit less complex than, somebody in their 40s or 50s. So with that feedback, what we did is we revamped the whole thing. So we said, all right, so what do we got to do to make it better? So we got credentialed under family medicine. We hired Aimee as our nurse practitioner, who comes with an extensive background in primary care. And then we went mobile, because a lot of the other feedback that we got was, if you come to us, though, then now we're talking. So that's what we did, right? Because who wants to get out of shift after being 24 hours to come to a clinic? No. So what we did is we created the mobile van, and hoping that we were going to partner up with towns, cities, municipalities, counties to say, hey, we'll do your physicals, but we're going to come to you, let's make a deal. So that's exactly what we did. So this is our team. So our team is the perfect marriage between scientists and the clinical world, right? So we have Dr. Kobitz, Dr. Cabal-Martinez, and Dr. Sali, who are spearheading the Firefighter Cancer Initiative. And then Jessica McIntyre, who's our Director of Clinical Operations at Sylvester, with Amber Thomas. They are on the clinical world, so they were the ones that figure out how do we make a clinic on a van, basically. So that was the brains. And then we have Dr. Christopher Pault, who's our medical director. He specializes in sports medicine, but as a fun fact, his dad was a retired firefighter from FDNY. So this is also very dear to his heart, because anytime you have a personal interest, then it just becomes that more and more special. And then there's Aimee and I. So going back to, the feedback that we got, and we said, okay, what is it that we need to be doing with firefighters? That is the million-dollar question, right? Like, nobody knows. So what we said is, okay, let's figure out what are the components that we need to have, right? So we have to have cancer screenings, we have to have a comprehensive physical exam, we have to do labs, hearing, vision, mental health. All those components is what we put out on the mobile clinic. So Amy's gonna get in detail.
Okay, so where did we base our guidelines from? So we went back to our 1582, right, that you guys are familiar with, Chapter 7, which is the guidelines that the closest thing we have to firefighter guidelines. So they're like the U.S. task force for firefighters. So we use that as our guide, but then with our research team, looked at the different research on what cancers basically you guys are at increased risk for, and then went above and beyond 1582. So then we put together, so what does that look like in actual practice, is all these different arms. So the first arm is our comprehensive health history and physical exam. So as a clinician, this is like the foundation, right? If I have any clinicians in here, this is like what you're taught in medical school or wherever you went to school. This is the foundation of everything we do with our patients. It's super important that you capture important history from the firefighters so that we can order the appropriate screening tests. So sometimes it's like pulling teeth, but we get it all out. So we use a hybrid system of both pre-visit screening questionnaires combined with an actual lengthy interview process once you're like on the vehicle. So those two things guide us. And then that way we're able to get a lot of information, not only from things about their occupational history, how long have they been on, what kind of decontamination practices do they use, what are they doing with their gear, and then also lifestyle questions, right? Because things like your diet, how much physical activity you get, how much sleep you're getting at night, how much caffeine intake, all of these things will actually affect your cancer risk. So we want to make sure that we're capturing that. And then the other thing that affects your cancer risk is if you're actually getting screened, right? You only will get the screenings that you know you need, right? So if you're, 60 and you don't know that you need a colonoscopy, you've just never had a colonoscopy. And I've definitely had patients like that, right? So we want to make sure that we're making sure that we ask the firefighters, what kind of cancer screenings have you had? When was the last time you had your skin checked? When was the last time you did have a colonoscopy? And they're like, look at you, like, what is that? So we capture that, and then anything that they're missing gets ordered, and I'll talk a little bit more about that process. And then we do a detailed head-to-toe physical exam, which then lets me capture as a clinician if there's anything abnormal on physical exam that maybe they haven't told me yet in their history, okay? And that guides everything moving forward. And then the next slide. So then we're able to do these laboratory tests, which basically is kind of like what you'd have done at your primary, but a lot more detailed. So we specifically go into a lot more detail on the thyroid. We do a comprehensive thyroid panel, including thyroid antibodies, because we know firefighters are at increased risk for thyroid cancer and thyroid disease due to occupational exposure, specifically PBDEs, which can affect thyroid health. And then we do additional cardiac risk biomarkers, which can help guide our testing that way, because that's another thing that firefighters are increased risk for, heart disease. And then something like vitamin D that we screen on all our firefighters, right? Because vitamin D increases risk for cancer, also is linked to other health alterations, bone health, heart health, autoimmunity, everything you name it, vitamin D is tied into it. So we screen for that and address that. And then hormone testing, because as we know, due to the shift work, we do see hormone health and hormone alterations in the fire service. So we test for that. And then PSA, depending, we start screening for the most part at age 40, but if there's family history, we start screening earlier. And then infectious disease testing, because obviously they're on the back of the truck with strangers, so we want to make sure they haven't picked up something that we don't want them to take back home with them. And then something as simple for a urine test, right? Something as simple as a UA, right? It's very simple, inexpensive test, is able to tell me a lot about the patient, right? If there's any blood in that urine that's never normal, so that's able then to guide me to then order additional testing. Same thing with our stool test, blood in the stool, never normal. So if they don't qualify for a colonoscopy or they're in the in-between years, so just so you guys know, colonoscopies for the most part start in the general population at 45, but at firefighters we recommend starting at age 40. And then obviously if you have a family history, sometimes it's even earlier than that. And then in the general population, it's about every 10 years if it's normal that you would go back. But in firefighters, we never wait that long. You would go every 5 years. In those in-between 5 years, we recommend stool testing for blood in the stool, which basically would be a way of catching any microscopic blood that is never normal that then needs to be worked up. And then, so it's kind of like the cancer screenings part, and then we have our vision and hearing screen, which just makes it comprehensive, right, because it's still part of the job at occupational noise exposure, so we follow OSHA standards for those. And then lung and heart health, right? We have our lung and heart bill here in Florida, and we know that firefighters are at increased risk for both of these. So I just want to highlight on the heart health side, we're able to provide CT calcium scores as a baseline, not only to look at their coronaries, but it also gives us a snapshot of their lungs. So if there's any nodules or anything that need to be tracked over time, it's kind of like a twofer. And then on the actual mobile clinic, we're able to do baseline EKG and then use some of our cardiac biomarkers in the labs to calculate their cardiovascular risk. And then our infectious disease testing, I kind of already talked about, right? The big ones, we want to make sure that they're immune to some of the stuff that they've had since they were vaccinated as a kids. And then checking for things like TB, hepatitis B immunity, and so forth. And then this other component, this is the newer stuff. So 1582, for those of you guys that don't know, just came out with new guidelines 2022. And this is what was added, right? So it's mental health was added, that wasn't there prior. And they finally recognized the need for that. So how do we screen for mental health? We use validated mental health screening tools, and all of these instruments are used in our pre-visit questionnaires, except for the PHQ-9 due to the nature of the PHQ-9, which is a depression screen. It also screens for suicide risk. So we definitely want to do that only the day of the visit, because we want to be able to capture if a firefighter is, having basically, severe depression or suicidal ideations, so that we could capture it during the visit. And then sleep screenings, obviously due to the shift work, that's another risk. So we use this multi-sleep disorder screening questionnaire that's able to capture if they're potentially having issues with things like insomnia, obstructive sleep apnea, and then able to refer them to a sleep screen study if they need it, if some of these screenings are positive. And then lastly, hormone health screening, right? I talked a little bit about how firefighters, due to shift work, are at increased risk for hormone imbalances specifically, right? In a largely male-dominated population, we see a lot of androgen deficiency related, even young, related to the shift work and the stress. So we screen with a questionnaire, and we also screen with labs, and then we're able to screen also for use of hormone therapy. Basically, unfortunately, hormone therapy clinics are popping up a dime a dozen, and they're not always doing things in an evidence-based validated way. So we definitely want to make sure that the firefighters are getting their hormones optimized, right? That we don't have a 26-year-old with a testosterone of 300, but that we also are doing it in an evidence-based safe way and not maybe increasing their risk for cancer or other things, okay? So that's part of our screening program. And then on the last slide, well, the second to last slide, it's all our cancer screening. So on the mobile vehicle, we're able to do all the screenings that are there to the left, and those are based off of either labs or physical exam, okay? And then based off of the history and my physical exam, then I'm able to order imaging-based screenings based off of what they told me. And then those get done at our physical locations. Referral-based screenings for anything additional above and beyond that they would need, like a skin cancer screening, full body screen, then we also refer them for those. Same thing with the colonoscopy, that's a direct referral, not to GI, but straight for the colonoscopy. And any other referrals that they need, because we're a network, we're able to coordinate that, and Johanna helps a lot with that. And then lastly, right, we have our education that we're able to provide, right? Firefighters need to know what they're at increased risk for, what screening tests they should be doing, and then what lifestyle prevention things can they do, you know, on the job, like all the things that, you know, decontamination practices and things like that, but off the job or on the job, like what they're eating, how much physical activity they're doing, knowing how important something like sleep is. So we provide that education as well. And then, so how does all of this get paid for? That's the million-dollar question. So there's different models that you can use to get this paid for. So one is, so some fire departments have a self-funded insurance, meaning kind of like you guys work with the insurance on what you guys want to include as part of what's covered under your plan. So in that model, you'd be able to partner with the insurance company, tell them kind of what you wanted included in that plan, and then everything would get billed to the insurance and paid for through the insurance. In the second model, we'd cut out the insurance company, right, because they're too complicated anyways, so we're just gonna go with a full cash-based model. Everything from the visit to the labs to the testing will all be cash-based. And then the last model is a combination model, which is the model that we use, which is basically a hybrid model between the two. We use the insurance for what the insurance will pay for. So insurances will pay for your annual physical, and it's usually at a no copay to yourself. They will pay for a CBC, chemistry, right? All these basic lab tests, a UA, inexpensive tests that they want you to have because they're screening tests. So what they pay for, we use. And then special tests such as like the CT calcium score that aren't standard tests, then we have special cash prices that we've developed based off of Medicare rates for the tests above and beyond that goes outside of the task force guidelines. And a little 2 cents about the task force guidelines. Unfortunately, there's no guidelines that are specific to firefighters outside of NFPA because really task force doesn't apply to firefighters. Each guideline clearly states that it's for people of average risk, which eliminates a whole class of people. So we definitely need to work moving forward to kind of make clearer guidelines for firefighters based, you know, that are evidence-based and based off of the research findings. Other logistical questions that we've gotten asked, we show up, you want to kind of go through like.
Yep, so going back to this model, right, and how we started the mobile clinic. So in January, we started with the City of Hialeah Fire Department. They were interested in providing physicals for their firefighters. And so what we did and how this all came to fruition is because they were already looking into doing this, right? This is something that their union stated in their contract, you have to be able to provide us with some screening. So what we did is we partner up with the city. There was, you know, a lot of going back and forth, of course, but we finally came to this partnership where the city decided that they were going to pay for it, and then, like Aimee explained, use their insurance, right? And so once that happened, the logistics or how we are doing it is Aimee and I are in the van. We go 3 days a week, so we go Tuesday, Wednesday, Thursday, so we can capture ABC shift, because in South Florida, they're most ABCs. There are a few Ds, but for the most part, it's ABC. And then we see 6 firefighters a day. So what that department did that was interesting was they take both units out of service, and they have so we get there early in the morning, obviously, because we're drawing blood. We have them fasting. But instead of having you wait until 3 o'clock to draw your blood, we're going to do everything in the morning. We grab an extra tube just in case there's anything that we need to add based on the conversation that you have with Aimee. And then the first, like the morning crew, stays to do their visit, right? So we do one at a time. That's where we do the EKG, the audiogram, all that good stuff. And then in the afternoon, they train. And so in the afternoon, those guys that were training in the morning, then they come and are seen in the clinic in the afternoon. So they're actually utilizing their time because they are putting in some training hours that you're still required to do. And then, you know, we're also getting their physicals done. So if you guys have any questions. Yes. I have no idea, honestly. I'm not sure what LifeScan is going for nowadays, so I don't know.
The other presenter, right? We use Medicare rates. So when you're a health system, you have to use Medicare rates. So the Medicare rate for an annual physical is somewhere between $200 to $200 something dollars-ish for the annual physical. And then the CT calcium score through UM for anyone is $100. And so is the low-dose CT. That one is a special program because you have to like qualify for the American Lung low-dose CT. And then lab pricing, that just would be based off of what package, depending on how comprehensive you wanted. If it was a comprehensive package, the labs, you could be looking at $200 or so just on labs. So you're looking at kind of the whole package, maybe like 500, 600, something like that. And that's like our prices based off of Medicare rates. That's how the prices were. I don't know how that compares to LifeScan, but yeah. So, and then it's a little bit different, again, because of the hybrid model. So everything that we're doing is evidence-based and then through the health system. So we have to be able to justify like certain tests that we order. So like I can't order a renal ultrasound unless I find something in the urine and things like that. So there's ways we can get it covered, but we just in an evidence-based kind of medical way.
No fitness component to it like LifeScan?
Not yet. That's something, so Chapter 8 is on the horizon. That's another reason why we partnered with Dr. Paul, because that's something that we'd like to incorporate. Right now, instead of stress testing people, right, we're CT calcium scoring them, which is kind of safer, right? We're not like treadmilling them and having them have chest pain. So the CT calcium score has been nice because we have been able to catch some CAD and definitely some pulmonary nodules that then we can, track over time and then refer them for the right therapy, right? Like if your calcium score shows you have CAD, you're not on treatment for that, then we're able to get them treated. So that's been nice. But yeah, I definitely think that would be a great thing to add more of the Chapter 8 stuff.
Does your program have recommendation dose separation like for retired firefighters? How much they stay on top of that?
So in Florida, they're covered for 10 years with our presumptive act, right? So with this department, that's what he said.
It depends, I think, on your department.
Okay.
Like the department that we're working with right now, they cover 10 years post-retirement. So what they want to do is at some point in life get them in to do their physicals,
Yeah.
right? With us.
So using the same model, but for the retirees that maybe haven't had primary care either. So having the retirees done the same package. And then, same type of thing, because again, like that department says that they're covered for anything that's found heart and lung or cancer for 10 years post-retirement. So they definitely want to get them in before that 10-year cutoff. Yeah.